Good evening, everyone. Thank you for joining us. My name is Michele Storms. My pronouns are she, her, and I'm the Executive Director of the ACLU of Washington. I want to give a big shout out to all of the co-sponsors and co-conspirators of this event, the Cedar River Clinics, Legal Voice, NARAL Pro-Choice Washington, NARAL's North Seattle Troublemakers, Northwest Abortion Access Fund, Planned Parenthood of Greater Washington and Northern Idaho, Planned Parenthood Votes Northwest and Hawaii, and Surge Reproductive Justice. This is a dream team of reproductive health and justice workers, and we're so proud to work and co-sponsor with them. Tonight, we're going to be talking about the recent Supreme Court decision, June Medical versus Russo, and its implications in Washington state and nationally. And we're hoping today with all of you that we can have a very different conversation from what the reproductive health movement has traditionally delivered. In this conversation, we strive to recognize systemic racism as intrinsic to the history of restricting reproductive health rights in this country, and to acknowledge and take action to counter the disparate impact restrictive reproductive health laws, policies, and practices have on people of color. This case, and certainly our work at the ACLU, is based in the Constitution, and the words of the Constitution are brilliant, but they were never meant to apply to me, nor to many of you. Those who wrote the founding documents owned slaves and were complicit in the genocide of our indigenous siblings. Women and children were chattel, beings of less than full autonomy in society. Generations of marginalization and vulnerability do not disappear in a moment. We have to fight particularly for those communities experiencing the deepest and cruelest forms of discrimination and indignity, and in so doing, we actually make the Constitution valid for everyone. We must acknowledge that racial disparities and gender discrimination aren't accidents. They flow from the legacy of the racism and patriarchy on which this country was founded. Right now, police brutality is one of the ways in which state violence harms, especially Black, Indigenous people of color. What happened to George Floyd was pure state-sanctioned torture with no indication of his humanity and seemingly no sense of remorse from the perpetrator. This shocks and hurts us because we saw it, but these killings have been happening for hundreds of years in this country. It is the state control, in this case by law enforcement, of the bodies of others, particularly communities made vulnerable by centuries of racism, classism, and other forms of oppression. So in discussing a lack of reproductive autonomy and bodily integrity, we're talking about what it means to allow some people to control the bodies of others. Now, in the policing conversation, I've heard it said that some people get to have public safety as a commodity. Literally, it's something they own. Yet those who are able to claim this privilege of public safety as a commodity have this commodity at the expense of others who are not entitled to that same benefit. Public safety belongs in our culture in current context primarily to white people at the expense of BIPOC people. This is a truth that must be changed. So we can look at reproductive health similarly. Some seek to own the rights to control the bodies of others. And again, this most harms the safety and health of those who have been made vulnerable by generations of oppression, whether we are talking women, women of color, trans, or non-binary persons. What is it that those who oppose reproductive health get to own at the expense of women and marginalized identities that do not get the benefit of reproductive autonomy? It's the freedom to the right to their own bodies. Reproductive oppression includes not just restrictions on abortion and contraception, but sexual assault, forced sterilization, and medical testing. It's about barriers to becoming pregnant and having healthy pregnancies and births, and it's about having a safe environment in which to raise children to adulthood, something that not all of us have the benefit of. When we look to reproductive health access, its history, and where we are today, we can see the interconnectedness of sexism and racism. Black people have been subject to coercive reproductive control since arriving in the United States. During slavery, Black women had the status of property subject to sexual and reproductive exploitation. In the 19th century, prohibitions on birth control and the criminalization of abortion had racial motivations arising out of white Anglo-Saxon Protestant fears of being overtaken demographically by non-white people. Forced sterilization of people of color through both overt and subtle means is also a dark part of America's history. This practice was explicitly condoned throughout much of the 20th century, well into the 1970s. Further, racial language has been inserted into anti-choice rhetoric about abortion and contraception. Abortion has been labeled as Black genocide, and statements such as Black children are an endangered species and the most dangerous place for an African American is in the womb have been billboard campaigns for anti-choice groups. This framing speaks volumes. It treats Black women as having no control, agency, or decision-making capability. The recent police killings we've seen, again, over generations, also lay stark the reality that people of color do not have a safe environment in which to become pregnant and raise children. Unfortunately, the reproductive health movement has played its own part in enabling racism. While in 1994, a group of Black women founded the reproductive justice movement to defend the needs of women of color and other marginalized individuals, including trans and non-binary people, many reproductive health organizations, including us, many of the organizations sponsoring tonight's event, did not fall into step. Rather, the reproductive health movement has largely continued to adopt a framework that ignores and minimizes the racism implicit in America's history and in the anti-choice movement. Systemic racism is seen in our police system and is seen in reproductive health care, with restrictions on abortion and contraception falling heavily on communities of color. People of color are more likely to be uninsured, face challenges in accessing care, including reproductive health care, and have higher rates of certain underlying and untreated conditions than non-Hispanic whites. People of color experience some of the highest rates of cervical cancer, unintended pregnancy, maternal mortality, and sexually transmitted infections in this country. American Indian, Alaska Native, and Black women are 2 to 3 times as likely to die from pregnancy-related causes than white women. The breast cancer death rate in the US is over 40% higher for Black women, and in 2018, Black women comprised 57% of new HIV diagnoses in the United States, and Latinx individuals constituted another 18%. As organizations, as advocates, and as individuals, we can and must do better. And obviously that starts with an acknowledgement of a context and the history in which reproductive health issues and battles are fought. So as we discuss June Medical versus Russo tonight, I hope we can all think about the history that has brought us here, acknowledge the communities most burdened when reproductive health care is restricted, and work together to address systemic racism. So we have really an incredible lineup of people to share with you this evening. And so I'm going to tell you who they all are, and then they will introduce themselves more fully to you and their work as they come on screen. So first, we will going to hear a legal perspective on June Medical versus Russo with Kim Clark, a senior attorney at Legal Voice, and Leah Ruttman, a policy counsel at the ACLU of Washington. And then looking at Washington on the ground with provider and patient perspectives, we'll hear from Mercedes Sanchez, the Director of Communications at Cedar River Clinics, and Amanda Saxton, the Board Director at Northwest Abortion Access Fund. Then from the community leadership angle, we'll hear from Surge Reproductive Justice, Jackie Vaughn, the Executive Director at Surge. And then, of course, most importantly, the action items. What can you do to make an impact? And we'll hear from Gabby Nazarai and Lillian Lanier. So I'm going to turn it over now to Kim and Leah, and thank you so much. Glad you're here.
Thank you, Michelle. My name is Kim Clark, and I'm a senior attorney at Legal Voice, and the focus of my work is reproductive rights, health, and justice. And I'm going to be talking about the plurality decision in the June Medical versus Russo case, and far more importantly, the concurring opinion by Chief Justice Roberts, which is really the opinion that we should all be looking at. But before I do that, I really want to echo what you just heard from Michele and say this, that I believe to my core that we are not going to move beyond where we are right now in the struggle for reproductive freedom if we do not make the link between racism and reproductive oppression and the religious extremism that you see today. And until we shine a light on that, I really don't think that we are going to make progress. And I really want to acknowledge the work of reproductive justice scholars who have been saying this for decades and whose work is brilliant and really provides a roadmap for us that we just need to follow. And hopefully by the end of this presentation, you'll understand what I mean, but I'm happy to take questions if you don't. And I'm also happy to answer questions by email later on if folks have them. So please reach out to us. Okay, hopefully everyone has done their celebrating about this opinion at this point, because as my colleagues will tell you, I am not especially sanguine about this case, or at least about the opinions other than plurality opinion in this case. June Medical versus Russo concerned a Louisiana statute that was virtually identical to a Texas law that the Supreme Court struck down just 4 years ago in Whole Women's Health versus Heller-Sat, which is why I have the pictures of the twins here. It's literally exactly the same statute. Both laws required that physicians who provide abortion care have admitting privileges within 30 miles at a hospital within 30 miles of a clinic. The evidence is abundantly clear that that these laws serve no medical purpose other than to obstruct access to abortion. Both Texas and Louisiana made clear, in fact, that that was their purpose. And yet this case was brought after having been decided by the Supreme Court 4 years ago. The state of Louisiana brought this case, and the Supreme Court took the exact same case 4 years later. What's changed since 2016? Two things, Justice Kavanaugh and Justice Gorsuch. And remember that Justice Roberts was initially on the other side of the Whole Women's Health case. So in Whole Women's Health, Justice Roberts actually voted the other way. And so there was an expectation among conservatives that the outcome might be different in this case, which ought to tell you something, in fact, about conservative claims that the conservative justices on the court are originalists or textualists, or my favorite is constitutionalists. That they thought the outcome would be different just 4 years later because there are two new judges on the court, I think speaks volumes. So the plurality opinion, I'm not going to spend a lot of time on, but again, if you have questions, burning questions, please include them in the Q&A, and please use the Q&A function to ask them. But basically the plurality opinion is what you would have expected. The court said, we've already decided this issue. The district court didn't err when it concluded that based on the facts that this statute would constitute an undue burden, and that it would present a substantial obstacle in the path of not all pregnant women, but a large fraction of women, or a large fraction of pregnant people. And the other issue that the court had to decide was whether or not abortion providers would have standing to assert legal claims on behalf of their patients. And the court said, of course, the court has long recognized that abortion providers have standing to advocate for their patients in court. So nothing terribly surprising there. What this means is that we're really maintaining the status quo, which of course, as Michele was describing, is deeply unacceptably unjust for lots of communities. Even if this law doesn't go into effect, with the state of Supreme Court jurisprudence right now, there have been so many laws that have passed muster that have made it incredibly difficult and unduly burdensome from a cost standpoint to access care. And that's why you see only 3 abortion providers in Louisiana. So it's a good decision, but really all it does is maintain the status quo. And I would submit that actually even that's optimistic. And that's because the only reason that the plurality carried the day in this case is that Justice Roberts concurred with the 4 liberal justices. But he did so not because he agreed with their reasoning. He did so because he concluded that precedent requires it. And in fact, he made very clear that he doesn't agree with the plurality opinion, or he doesn't agree with the reasoning of the plurality opinion. In fact, what he said was, what he did was provide a roadmap to the right to justify abortion restrictions in the future in a manner that would allow the court to uphold them without looking as though it was upsetting longstanding precedent. So here's what he did, and here's what I mean by that. Casey versus Planned Parenthood, by the way, is really the law of the land. Casey narrowed Roe versus Wade, so it's not Roe v. Wade that is really at risk, because that is really no longer the law. Casey narrowed Roe, so it's Casey versus Planned Parenthood that is the case that now stands for the that now upholds the right to abortion. So what Robert said was, the state hasn't asked us to overturn Casey versus Planned Parenthood, but he kind of suggests that he might if it did. But he goes on to say, and he sort of does the next best thing, and he says, he reminds us that under Casey, medical necessity is not the only justification for abortion restrictions. States can actually pass laws that ensure that pregnant people, in the words of Justice Roberts, know that there are philosophical and social arguments of great weight in favor of continuing the pregnancy to term. In other words, laws regulating the medical care of people who have uteruses need not be based in medicine. On the contrary, states can enact laws that serve no purpose other than to lecture pregnant people about the gravity of the decisions they're making, which of course are decisions that Justice Roberts and that neither Justice Roberts nor any of the conservatives on the court would ever be faced with, as long as the law does not prevent them from ultimately getting care. Why? Because the state, says John Roberts, has an interest, and this is one of the flaws in Casey, frankly, says that the state has an interest in protecting the potentiality of human life. And how, of course, you weigh the state's interest in the potentiality of human life against the burden that an abortion restriction might impose on pregnant people? You can't. So it's sort of the ultimate mic drop. So Robert says, we really shouldn't be weighing the burdens of these statutes against the benefits. We should just be looking at whether or not the statute amounts to a burden, which really, in fact, it's an extraordinary interpretation of whole women's health that basically strains doesn't pass the straight face test. Which is, for all of his talk about respecting precedent, really shows that he's not too terribly concerned with precedent. And of course, it's entertaining. Justice Gorsuch does call him out on this, but I'll let Leah explain that. What I can tell you is that I'm already seeing states or the other side take advantage of this argument that abortion restrictions can just be based on the state's interest in the potentiality of human life. I have a case in Idaho right now where that's essentially happening. But what really strikes me about this is, why don't we interrogate that claim that the state has an interest in the potentiality of human life? The conservatives on the court will bend over backwards to interrogate the state's purported interest in laws that burden other constitutional rights. The right to religion, for example, the Masterpiece Cake Shop case really proves that. But make no mistake, the state has not always concerned itself with protecting potential life. And it so clearly doesn't do so now when it comes to Black and brown bodies. It is true that by the time of the 14th Amendment was passed, there were laws criminalizing conception and abortion, but as Michele mentioned, and what you never see in any of these opinions is that the court even mentioned, much less reckon with, is the extent to which those laws were rooted in the respect, not in the respect for potential life, but the fears of white Anglo-Saxon Protestants that the white race might be overtaken if white women had access to abortion and contraception. The fact is, this is not some universal truth that is handed down by God. This is and always has been about patriarchy and white supremacy, and about the fear of a loss of power among white men and white women, frankly. And, the religious right and the conservatives on the court so often preach about morality. Shouldn't you know, the white supremacist origins of this view be something that we interrogate as well? Shouldn't that be something the court interrogates? Why hasn't the court looked at it? And frankly, why haven't we demanded that they look at it? And I just want to close this by saying, you know, and this is not the rosiest forecast, but John Roberts is supposed to be the good guy in this group. So with that, I'll turn it over to Leah to talk about the remaining decisions.
Hi, everyone. And unfortunately, not shockingly, I'm going to start by talking a little about Justice Thomas's dissent, which is really based upon getting rid of Roe. It's really based on getting rid of Roe. So what we're talking about when we talk about Justice Thomas is he fundamentally believes that the Constitution does not constrain the state's ability to regulate or even prohibit abortion. So any state under the Constitution should be able to completely prohibit abortion by his reading. His reasoning for this is based on, and Kim was talking about this a bit, a textualist, originalist approach, where he's basically saying the right to abortion isn't explicitly in the text. It can't be read into the text. And when the framers were putting together the 14th Amendment, they weren't really thinking about a right to abortion, which, like, I'll give it to you, Justice Thomas, they probably weren't. With that said, under our current law, as law has expanded, as the Constitution precedent has been created, we do have certain fundamental rights that, if abrogated, are violations of due process. And that is exactly what the right to privacy and the right to abortion has become. These aren't new arguments for Justice Thomas to be making, but they're not where the law is today, which I would say is a very good thing. But more than anything else, what Justice Thomas is trying to get at through his dissent is that Roe versus Wade and all the cases that have followed it should be overruled. So now let's talk a little bit about Justice Alito. I hated this dissent. Justice Thomas, while we might disagree on every single point, and we do, at least he was very straight up about his opinions and it was clear where he was going. Justice Alito, I would argue, and there was some sleight of hand here. So he made a standing argument because that was par for the course in this case. All the justices did it. And then similar to Roberts, he kind of gave a shout out to Casey being re-examined, right? He said, oh, you know, no one's asked us to do this, ... By doing that, he was saying two things. He was saying, one, Casey is where we stand with the law right now. So he is rejecting the balancing test that came in 2016 with Whole Woman's Health, and instead saying Casey's standard is what applies. And then what he was also doing is he was saying, hinting at the idea that he, similar to Roberts, might be interested in overturning Casey. What's really interesting about that is, as Kim pointed out, Roe provided a right to abortion, and Casey actually narrowed that right. So if we re-examine Casey, there are two things that could happen. One, you could overturn Casey, and then you'd actually be left with better protections for reproductive rights because you're left with Roe. I am just going to guess that's not where Alito or Roberts was really going with that. Just a guess. What they were probably getting at is one of two things. They either want to look at Casey and they want to make a test that would provide for greater restrictions to abortion, allow states to provide greater restrictions, or alternatively, what we're really talking about when we're talking about re-examining Casey is also overturning Roe, similar to where Thomas was going, but in different words. The other two arguments that Alito made were really problematic to me. The first is, and this is where my Star Wars reference, thank you everyone, came from, is he tries to make an argument that the two cases are not the same. In fact, they're very different. And he's basically arguing with Chief Justice Roberts, who's basically forced to agree with the concurrence, to concur in this case, solely because it's the same case. So it was decided on the basis of stare decisis. Justice Alito trying to say that's wrong and these cases are different, really, it stretches credibility, it stretches believability, really. We're talking about the same statutes being argued under the same laws with the same harms that were found. It just seems like a really, really poor, tenuous argument to me. But then we talk about the good faith argument, and that's the one I really took issue with. So what Justice Alito was trying to say here is the district court should have looked to ensure that the abortion providers who were trying to get admitting privileges in this case, that they were doing it in good faith. Because he argues that they have a strong incentive not to try to get admitting privileges. His logic here is that these providers know that if the law gets overturned, that the law is rejected, that they won't then have to get these admitting privileges. Things can continue as is. So they have all the reason in the world to not try to get the admitting privileges, and then the law will be rejected. The part that's missing here is there is absolutely no reason for these abortion providers to think that this law is going to be overturned. I don't think there's anyone in the entire reproductive health movement who is sitting around being like, you know what? I am very confident that Kavanaugh, Alito, Thomas, etc. are going to uphold my right to abortion. The exact opposite is obviously true. So the idea that these providers weren't trying in good faith to obtain admitting privileges and using that as a hang your argument on seems pretty weak to me. Kim, can you go to the next one? Much. And then we'll talk a little about Justice Gorsuch and Justice Kavanaugh. So again, the relevant standing arguments were made by Justice Gorsuch. And then he makes an argument regarding facial challenges. And basically what he says is a law must be unconstitutional in all of its applications to fail. And what does that mean? Well, he actually gives us a variety of examples, and I'll explain it using Seattle as an example. Basically what he's saying is, let's say there's an area in Seattle where wealthy white women are still able to access abortion. Well, that's great. And maybe nowhere else in all of Washington state can anyone access abortion. Well, in that one area, the law is not unconstitutional, and therefore it does not fail. I really wanted to highlight this point because I think it really speaks to how the law fails all of us and really fails us when we're talking about race equity and health equity, because it makes things so incredibly unequal. It is not the application used by the plurality in this opinion, thank goodness, but it was what one of the justices was trying to advocate for. I then also want to mention that Justice Gorsuch rejected the balancing test, similar to Justice Roberts, but then he really called out Justice Roberts. He is not happy with him, and he wanted that to be known. And one of the ways he called him out was by essentially saying that while he agrees with rejecting the balancing test, he at the same time thinks the test Justice Roberts came up with, which really focused just on the burden, is absurd. It does not exist. It's an alternative he's essentially made up in his own head, and it also cannot apply. And I really wanted to highlight that because that's very important when we get to Justice Kavanaugh's dissent. Justice Kavanaugh's dissent was very short, longer than what I have here, but still very short. But what's really relevant is he said that today 5 members of the court reject the whole woman's health cost-benefit standard. And that is the balancing test we keep talking about here that has existed since 2016. What Justice Kavanaugh seems to be trying to say here is that balancing test is no longer good law because 5 members of the court have rejected it. I would say that just because you write it does not make it so. Justice Gorsuch and Justice Roberts clearly disagree on what the test is. And Justice Thomas, in his decision, specifically said, no 5 justices can agree on the proper interpretation of our precedent today. So without the balancing test, there would be no test that existed. Moreover, it's unclear where some of the justices came out on the balancing test. I would say, however, where that leaves us is we have been saved for now. Everyone should celebrate. It was a decision that we should all be happy about in the very, very, very near term. But what has been signaled by the dissent and by the concurrence is there is a majority of the court who has every intention of pushing back on abortion rights, be it by narrowing or outright overturning Roe. And at the very least, what we're going to see in the very near future, I think, are arguments that the balancing test established by Whole Woman's Health should no longer be in existence even before it reaches the Supreme Court. So where does that leave us? I want to shout out a call for movement building. I think we need to center race as we've been discussing, and I think we can have cultural movement change that impacts the law. Movement building is important in and of itself, But when it comes to the law, it has a very, very real impact. And I think the one thing I want to mention here is marriage equality in 2015. If you talk to some of the attorneys who were involved in that case, they'll talk about how a similar case was brought in the 1970s and it got nowhere. And what the big difference is, they were right back then. It was the same arguments. It was the same law. The big change was cultural and movement and how these things can really make a huge difference. The law moves much slower than culture, than people, but it does change and it is influenced. And justices and the law don't live in a bubble. So as we can move forward as a movement and as we can change the way we talk about this and center race equity, so too can hopefully the law change. Thank you. And I think I am introducing Mercedes, is that correct?
Yes, if I can unmute. Hi, this is Mercedes with Cedar River Clinics. We provide reproductive health care, including abortions, in our clinic locations in Renton, Seattle, Tacoma, and online through telemedicine. I'm starting today by talking just a little bit about systematic racism in healthcare. We could have a whole series of webinars about that subject. One of our providers, Dr. Anuj Katar, recently co-wrote an article titled "Healthcare is Complicit in Racial Injustice." It'll be put in just a few seconds on our chat, a link to this article. But basically it discusses how systematic racism presents itself everywhere from medical school to lack of representation in the medical workforce. And as we are now seeing with COVID and decades of all healthcare, the huge health disparities Black, Indigenous, and communities of color experience. Honestly, significantly more Black lives have been lost to systematic racism in healthcare than those caused by the police. With reproductive healthcare, there have been many calls and actions for change for a long time. I am a board member of the Abortion Care Network, which is a national membership organization for independent clinics. In 2018, the Abortion Care Network, recognizing that an anti-abortion framework is a necessary part of exceptional abortion care, refocused its values on undoing racism, intersectionality, and reproductive justice. And a link to those values will also appear in the chat box. This was done hoping to lead the charge for change with its members. I know it is also something that Planned Parenthood is working on. For many clinics, it's a work in progress, but I hope with current events around Black Lives Matters that it lights a fire to speed up change in reproductive health care. As Dr. Katar said in his article, healthcare must look into the mirror and critically evaluate its own role in health disparities and injustice. We must not escape the critical eye of reform. Racism is a huge determinant in the future of abortion care and SCOTUS decisions. It can't be ignored that most anti-abortion organizations who are helping craft legislation and that are part of legal actions are also linked to white supremacy. This has been a huge problem in Eastern Washington, where for the last 2 years, a group calling itself the Church of Planned Parenthood, which is associated with a variety of alt-right militia groups and hate groups, has been holding massive protests outside of Planned Parenthood in Spokane. The group openly advocates that any law that conflicts with God's law should be disregarded. And many of its members, including its leaders, openly carry guns to the protests. This is a real cause for concern with the SCOTUS decisions, which will incite these extremist groups to become more active and to implement more extreme tactics, especially since Justice Roberts basically gave them a roadmap for how to win future SCOTUS cases. Today, I'm also speaking on behalf of clinics to give our perspective on abortion access in Washington and to update you on where we currently are amid the COVID crisis. Our friends at Planned Parenthood acknowledge that they get a lot of attention after a SCOTUS case. So they want to help lift up independent clinics like Cedar River clinics. I'm gonna share a slide in just a moment. Sorry, technical difficulties. As you can see from the infographic, independent clinics provide the majority of abortion care in the US, and the percentages increase through second trimester abortions. This is important because providers and activists across the country are expecting a COVID pregnancy boom, and we are especially expecting a surge in second trimester abortions because people have waited to access care for so many reasons related to the virus. Independent clinics have been hit hard by the coronavirus. In the interest of protecting patients, staff, and our communities, we have had to reduce appointments and spread them out to help reduce risk. Nationwide, since the start of COVID, 92% of clinics have needed financial assistance, and over 50% have seen patients traveling from out of state, including Cedar River clinics. Hostile states are taking advantage of the pandemic to limit access. At the beginning of the pandemic, even though Washington was one of the epicenters, people were still willing to travel here to get care with us. There will always be a need for abortions and contraception, and that's especially true during a pandemic. Although the SCOTUS win was important and we should celebrate every victory, abortion access was not protected or expanded, and access is still out of reach for many. The map on the right side is a couple of years old, but shows the number of abortion clinics by state and why there is such a need for people to travel. It's not just national. Barriers to abortion impact Washington state residents as well. There might not be restrictive laws here, but there are serious systematic and financial barriers to abortion. And those barriers fall on people who already struggle to get care. Black, Indigenous, and people of color, as well as LGBTQ people, young people, and people living in rural areas and those with low income. Whether it's directly or indirectly, many of our institutions keep these communities trapped in poverty, which greatly impacts healthcare. For abortion, barriers include cost of care, lack of insurance, and lack of paid time off to get that care. There are also too few clinics within communities, and waiting periods, whether they be legal, financial, or COVID related, can result in the need to travel, overnight stays, the need for childcare, and time off work. This is true across the country, but here in Washington too. We have many people traveling to our clinics from all over the state. Those in rural communities either don't have access to nearby clinics, or the wait times at more rural clinics can be up to 6 weeks long, so they're forced to travel. Because of systematic racism, Black, Indigenous, and communities of color are more likely to have lower income and are seriously financially under-resourced for everything, including healthcare. Undocumented people and immigrants are challenged by rules that require patients to show ID, by ICE activities and fear, and lack of translated resources. Information and resources about care are often inaccessible, insensitive, or may not feel relevant to those communities. Cedar River clinics, Planned Parenthood, and all our wonderful allies have worked hard to combat the challenges and barriers, but there's still a lot more work to be done. The most significant barriers to getting abortion care in Washington are mostly financial, and it's been made worse by the COVID-19 crisis. Oh, sorry, I'm fighting with my slideshow again. As you can see by the map that got added on the bottom, since the COVID-19 crisis started, and since March, 1.2 million Washingtonians have filed for unemployment, which means many have lost their access to health insurance. We expect to see an increase in Medicaid need and enrollment. Right now, Washington State is facing an $8.8 billion budget deficit, and funding for family planning and Medicaid coverage for abortion could be cut. Add to that, last week, the Trump administration asked SCOTUS to overturn the Affordable Care Act during a pandemic. This last infographic also shows who would be most affected: women, communities of color, and young people, and those who are below or at poverty level. My last infographic also shows how short-sighted cutting family planning funding is. In 2019, nearly $89 million in government savings was realized by investment in family planning programs. So, what do we need to do? We need your help defending reproductive health care in Washington. Tomorrow, we will be sending out a follow-up of action items and links for everyone. So please read that carefully and share with family and friends, because action is definitely needed. It's a perfect storm right now, with both clinics and patients being deeply impacted. Cedar River Clinics is grateful to the Northwest Abortion Access Fund for all they do to help our patients get to us. And that leads us to our next speaker, Amanda.
Hi, I'm just going to share my screen real quick. So I'm a board member of the Northwest Abortion Access Fund. So I'm just going to give everyone a little bit of information about us. We serve Alaska, Oregon, Washington, and Idaho. So we serve 4 states in our region. Our mission is to fund abortion and break down barriers to abortion access for people in the Northwest. Our values are trust and respect, autonomy, intersectionality, reproductive justice, racial justice, economic justice, and culture shift. So we really strive to have a very anti-racist lens and be as anti-racist as possible, especially given the current state of things. We're one of around 70 member funds of the National Network for Abortion Funds. So they kind of connect all the abortion funds around the country. What we do direct abortion funding. Our average grant size is $350. We also provide logistical support. So we help clients with air travel, lifts, homestays, hotel stays right now with COVID-19, resources and referrals, support to other funds. Abortion funds provide direct support to overcome financial barriers. So that's why they're so important right now, is because it's one of the direct ways that we can help, especially Black and Indigenous people of color, overcome those financial barriers. So I just wanted to go over our June statistics so you could get kind of some more exact numbers. Our direct funding in June, we had 88 grants, and those are grants that go directly to clinics. The average grant size got cut off, sorry about that, but it was $287. And then our total grant amount that we gave out in just 1 month was over $25,000. We had 17 travel cases, and we spent $3,714 on funding for those. About 17% of our intakes are from Washington. The majority of our cases come from Idaho due to its much more restrictive laws. I anticipate that intakes from Washington are increasing also due to COVID. We're starting to track that on our hotline. Statistics, and I think 24 people last month reported that they were impacted by COVID-19. I just wanted to also highlight real quick, while I had everyone's attention, this super awesome print shop has agreed to basically print our merchandise at cost. So there's a website there if you want to get some cool abortion support gear and support an abortion fund. Most of the money for that will go directly to our funded partners. And that is about all I have to share. So I will pass on to Jackie Vaughn.
Good evening, everyone. Thank you so much for giving us a rundown of what this case looks like and what its potential implications are. And it's wonderful to hear the work of local abortion providers and the work that's happening to make sure that we also have a discussion on access and accessibility to abortions. My name is Jackie Vaughn. I'm the Executive Director of Surge Reproductive Justice. At Surge, we envision a world where all communities are free from reproductive oppression, racism, and violence. The work that we do, we mobilize communities to build a world where all people can make powerful, self-determined choices for their bodies and the future of their families and communities. Our work centers Black women, women of color, and queer and trans people of color for a movement that rises from the bottom up. I want to speak to you all tonight about what does reproductive justice look like and mean in this world regarding like the cases that we're seeing around abortion restrictions, and then also the structural violence and oppression that is being targeted towards Black communities and other communities of color. So when I think about reproductive justice at Surge, we really see it as an action word. And we use tools and a framework called abolition democracy in our work, meaning that while we have this conversation about the right to abortion and the constant threats to abortion, what we're really looking at is trying to zoom out and think about how structural oppression and violence that has specifically been designed for the Black community and other communities of color, how that impacts all of us, and the need regarding abolition democracy is to take down all of these institutions and rebuild them from the ground up, starting with those communities who have been most impacted by this structural violence and by this oppression, structural oppression. When I think about reproductive justice, the world that we're trying to create is one in which folks that want to terminate their pregnancies have the ability to terminate their pregnancies, and those who want to have children are able to have children in safe and sustainable communities. And those are some of the foundations of the world that we're trying to build with a reproductive justice framework. And in order to get there, we really must critically examine these institutions that are all carryover institutions from slavery and all are rooted in a history of anti-Blackness and state-sanctioned violence and structural oppression. So what does that mean to rebuild these communities in a way that benefits everyone, and understanding that when we can marginalize the few in our community or enact and condone state-sanctioned violence and structural oppression to certain communities, that impacts all of us. And so we truly believe in creating processes where those who experience multiple systems of oppression simultaneously have the tools and resources to build, create, and direct the solutions that are going to benefit their communities, which then benefits all communities. The solutions that we want should come from those that are directly impacted, and that is what reproductive justice is about. So when Surge explicitly says that we are working in our communities to create solutions, we are very adamant that we create processes that build power and self-determination and autonomy for Black communities, Indigenous communities, and communities of color. Always bringing things back to how it is rooted in structural racism and violence, that when we talk about bodily autonomy, we also have to realize that for 500 years, the Black community has never had bodily autonomy and has never had self-determination and autonomy at a systems, institutional, and structural level. So the reason why we can see Supreme Court cases like the one in Louisiana is because of the history of systemic oppression and violence towards the Black community. And so, as you can see, I'm wearing a shirt that says Defund Police. Surge is actively a part of the Defund SPD campaign that is happening in Seattle, because we know in order to create a world where folks actually have bodily autonomy and freedom, that is determined by these other systems that all interact. There's no way that we can protect access to abortion, the right to abortion, without looking at all of the systems that impact especially Black and Brown communities' abilities to make choices over their bodies. And so I encourage people to really zoom out and look at the connections between these institutions and understand that you cannot make one decision in one area without addressing how systems and institutions inhibit communities' ability to make decisions in other areas. So thank you for having me today. And I am going to pass it off to, I believe, Gabby. Thank you.
Thanks, Jackie. Hi, y'all. I'm Gabby. I use she, her pronouns. I'm the organizer with NARAL Pro-Choice Washington. I'm super excited to be here tonight and talk to y'all about the actions that you can take. You know, we have heard from multiple perspectives at this point about this Supreme Court case, and I think it's really important that we start to look at actions that center racial equity and center racial justice, and also make sure that we're not just on the defensive and protecting abortion, but rather we're looking at how we can expand abortion access and make it available to all communities and not just a certain subsection of the population. So I am going to share my screen as well. And as it's been mentioned before, we will send out a follow-up PDF with all of these actions listed out for y'all, so it's super accessible and ready for you to just get started on that. But our first set of actions we're asking folks to take today is to contribute financially to 3 local organizations. Mercedes, Jackie, and Amanda all did a wonderful job at describing who these orgs are, so I'll be brief, but the first One that we're asking you to donate to is Cedar River Clinic. As you heard from Mercedes, they are a social justice org that combine direct health services with advocacy, activism, and community education. And they're not only providing abortion and reproductive health care to folks in Washington state, but they're also providing it to folks across the nation. In the last 5 years, Cedar River Clinics has served patients from 30 different states. So that can let you know how important these independent clinics are, specifically Cedar River, who are allowing folks to access abortion no matter where they are in the country. In addition, over 60% of their clientele are low income. And so again, it's crucial that we're supporting clinics on the ground that are providing abortion and reproductive health care to folks that need it most. The second org we're asking you to donate to is the Northwest Abortion Access Fund. As you heard, it's an abortion fund that serves Washington, Oregon, Idaho, and Alaska. And I think a really important statistic to say is that in 2019, NWAF funded over $380,000 of abortion costs for 1,000 callers. So we know no matter what the political climate is around abortion and reproductive health care, no matter if someone has insurance or not, abortion is an expensive medical procedure, and we need to be supporting organizations that are funding it and making it available to all folks. The last org is Surge Reproductive Justice, and you just heard from Jackie. And Surge is an organization that's working to end the reproductive oppression of all people. Again, they're centering Black women, women of color, trans and queer women, queer people of color, and Surge works on 3 key issues that they find vital to ensure reproductive justice. That's access to reproductive health care for immigrants, ensuring birthing and reproductive justice for birthing people and parents in prison, and ensuring we have comprehensive and progressive sex education. It's vital that we're following the lead of reproductive justice orgs, so I encourage y'all to donate to Surge. And now I am going to pass it over to Lillian to talk through some of the immediate actions that you can take right now in Washington State.
Hi all. For a brief introduction, my name is Lillian. I use she, her pronouns. I'm the political and organizing director for NARAL Pro-Choice Washington. Glad to be here with you all tonight. As promised, we do have some immediate tangible action asks that you can take right now to fight for expanded abortion access and reproductive health access in Washington. Again, these are not the single answer to this moment, but as we focus on expanding meaningful access to reproductive health care and making sure everyone can get the care they need, these are critical steps in that direction. So the first action we're asking you all to take is to help us protect and increase state funding for family planning and Medicaid coverage for abortion. The unexpected occurrence of COVID-19 and the response by our state has created substantial deficits in our state budget. And because of this, our legislature is thinking through ways to close gaps in our state budget. In the last few weeks, we've seen proposals that include cuts to family planning funding by $2 million and cuts to Medicaid coverage for abortion. And so tonight we're asking you to contact your state legislators and to contact the governor and ask them to protect and increase funding for these vital reproductive health services now and in the future. Budget cuts to these services would cause thousands of Washingtonians to lose access to necessary health care. And so in our follow-up email, we'll have a link and a script that you can use to contact elected leaders here in Washington. And the next is to advocate for progressive revenue. One of the reasons we're seeing our state legislature make these proposed budget cuts is due to Washington's upside down tax code. Right now in our state, we have a broken tax system where low-income individuals are paying 6 times as much of their income as the wealthiest Washingtonians. Quite literally, those making the least pay 18% of their income into state and local taxes, where the wealthiest people pay 3% or less. And we are requesting that our legislature pass progressive revenue to fix our broken tax system, stand up for low and middle income families, and close tax loopholes so that the wealthiest in our state pay their share. This will mean that we'll have revenue to invest in the foundations of our community, including healthcare and reproductive healthcare, and make sure we're not in a position where our elected leaders are having to make knee-jerk cuts to vital services. We've got a petition in our email for you to sign down with. And then the next one is join our campaign to protect comprehensive sex education for Washington and approve Referendum 90 on the ballot in November. As so many of you on the call here tonight already know, earlier this year, our state legislature signed a law requiring all public schools to teach medically accurate, age-appropriate, and inclusive sex education. Opponents of the sex ed law launched an effort to put this issue on the ballot. And so we're asking you to join our campaign by liking our Facebook page, sharing the page with 10 of your friends, and committing to spread the word between now and November that we are approving Referendum 90 to ensure quality sexual health education for all Washington youth. So I'll pass it back to Gabby for a few more actions.
Thanks, Lillian. So another action we want to encourage y'all to take right now is to stand in solidarity with Black communities across Washington state and the nation. In the past month, we've seen incredible mobilization around the nation fighting against police and state-sanctioned violence, anti-Blackness, and systematic oppression that has long been present in the United States. And we have linked a petition in that email you'll receive created by Black Lives Matter King County, the King County chapter. And we encourage you to sign this. And this petition has a number of demands, but the two demands I'm going to talk about right now is one, to defund the police, and two is to invest in Black communities and distribute funds into community-based programs like healthcare, education, transportation, and housing. And Jackie already did a beautiful job about talking about how we cannot separate our movement for the movement for racial justice and for the movement to defund the police. But these two things are intrinsically connected. Reproductive justice orgs and Black women have long been calling on the white mainstream reproductive rights movement to focus on more than just choice when it comes to reproductive health care. We must create a society where everyone has the right and the ability to live in safe communities and make choices for their own bodies. So again, just reiterating what you've heard from a number of speakers tonight, but I encourage y'all to tap into different movements happening on the ground for this movement. It's connected to reproductive rights, and I just encourage y'all to do that. The last two actions I'll quickly go over is they're both quite simple and easy, and I'm excited to talk about them. But one of the simplest ways that you can support your local abortion clinics is by using these clinics for your medical care needs and your reproductive health needs. These clinics offer so much more than just abortion. They offer contraceptive care, annual exams, pap smears, STI testing, and treatment. And independent clinics rely on people like you seeking these types of services to stay financially secure and to be able to provide abortion care. The other is to register to vote and check your voter registration. I should make the disclaimer that's not easy for everyone, but I encourage folks that it is easy for to do that. And we need to make sure that we're having elected officials in office who are on the same page as their communities and listening to their communities and are working to protect and expand abortion access for all. And I'll finally pass it over to Lillian to talk about how you can get involved with the organizations here tonight.
Yeah, absolutely. Thanks, Gabby. So to echo, what everyone has been saying, our work together doesn't end tonight. It doesn't end with this decision or after we've taken digital actions from our homes in the coming days. We have big and bold and challenging work to do together that is going to take time. We're fighting to make sure that every person in our state has immediate, affordable, and reliable access to the care they need. We're fighting to dismantle systemic and institutional racism that lives in our healthcare system, in our policing, in our tax structure, in our organizations, and in our daily lives. We know we need culture shift and movement from the ground up, and really to follow the leadership of directly impacted communities who know best what they need. And so after tonight, in this email that you will receive that has all these action links, we'll have links for each of these organizations. And each partner in this event is doing vital work to expand access here in Washington. There'll be links to sign up to campaigns, become a member or volunteer, or follow us on social media. But really, we want to do this work with you. We want to be in this fight with you. We want to learn with you. And so we look forward to being in touch and continuing this fight together. And with that, we'll pass it back to the group for Q&A.
Thank you so much. I so appreciate each of the presenters and just the depth of information. And I appreciate the people who are here in the audience for sitting with us. And we have run a little bit over, but we want to try to get a couple of these questions in because there were some really great questions that came from the audience. So a couple of legal ones. And one of them is, if Roe was overturned, would that mean that the states would govern what abortion rights are available for people? And if so, then that would seem like why it'd be very important to elect people who care about reproductive health. So maybe Kim or Leah could take that on.
Yeah, I mean, I'll take it on. Obviously the law in Washington is fairly progressive when it comes to access to abortion and contraception, and it would mean that we're relying on the legislature to hold the line, basically. Washington also has a strong state constitution, so that could be some safeguard as well. But the other thing to think about is that we're really counting on the electorate as well to defend against harmful referenda and initiatives that would impact access to abortion. In fact, we talked about R90 and R91 that relating to sex ed that'll be on the ballot in November. But lest people get too comfortable, there is also a heartbeat bill that could wind up on the ballot in November. So it could happen here. It's a very real. Washington is one of those states that's in good stead, but it's even here, we have to be vigilant.
Absolutely, we do. One of the people in the audience observed that 5 of the members of the Supreme Court are Catholic, and apparently that's down from 7. And so this person observed the elephant in the room is we rarely include their religious dogma, but that's a real bias in their decisions, in our discussion and analysis. And so this person asked that we comment on whether that's true and relevant and how that shows up. And I think Kim or Leah, that's a good one for you as well.
I can start, and then I'm sure Kim will want to add in because she has strong opinions about this too. So I think I can't say whether the justices' particular religious leanings play into bias within their decision making. What I can say, and what's clear from all the decisions and oral arguments and things like that, is an enormous amount of weight, which is outside when it comes to most anything else, is placed on religious and religious rights, irrespective to all else. And does there seem to be biases of some sort playing in there? Yeah, absolutely. And I think when we're talking here and when we're talking about racism and how that plays in, part of the conversation we're talking about here, and Kim can elaborate on this a bit, is why is the conversation always about religion when we're talking about reproductive health and not about these other factors like racism, which are so key? And is that one of the reasons that sometimes we're losing? Kim, you want to take it?
Yeah, no, I think you did a great job with that. I mean, I think that one of the things that the points that I was trying to make is that our side, I think, has been too timid about interrogating this purported state interest in the potentiality of human life, as though this is something that is dictated by the Bible that we can't possibly question. Where, like I said, the Supreme Court's been very, has scrutinized very closely other state laws where the state, purports to, have an interest, where other cases in which the state purports to have an interest in a law that burdens another fundamental right, say religion, for example. So yeah, I mean, I think, and I think we have been reluctant on the reproductive rights side to really challenge that, and I think that's been to our detriment. I mean, I think it's one of the ways that the anti-choice movement, it is undeniable. You can see it clear as day today, just as it's always been, has deep roots in white supremacy, which is not to say that every person who is anti-choice is white supremacist, but religion is how they've grown the movement. And I think it's really important that we start to call out that religion really is just a tool for, to kind of whitewash that image, and you know, and not just to kind of hide behind, but it's now being used really as a you know, it's really becoming weaponized by the religious right to undermine the rights of people who can become pregnant and LGBTQ people, and really to advance a, you know, very racist agenda.
Yeah. So, you know, Kim, you referenced the potentiality of human life. And so someone also said, well, isn't the state's interest in the potentiality of human life secondary to the state's interest in the children or adults who are already born? Seems like the states aren't doing all they can right now to support the health, education, and welfare of existing citizens. I mean, I feel like the answer to that was right there embedded in the question, but but if you want to comment on that, you can. And then I'll just have two more quick ones that I want to hit on. You want to comment on that at all, or?
No, I mean, I completely agree with that. I mean, I think our side has made an effort to point out the hypocrisy oftentimes in the on the other side, but yeah, I think it's so important to understand where this sort of reported interest comes from. I think that would really change the discussion for a lot of people.
And I would add to that, when Michele was talking about reproductive oppression, so much of that did involve not just what we're talking about when we're talking about abortion and birth control, but also safety and the environment in which children are born and raised. And so it is all part and parcel of the same thing. And we should be thinking about it together rather than separately. And then unfortunately, it's not been the case in many instances.
Great. So this one I think is for Mercedes, because this is about health care access. So the question is, for wealthy women who have health insurance, don't abortions typically occur in regular OBGYN clinics with their primary physicians, or perhaps they're just called incomplete miscarriages with a DNC? Mercedes, do you want to speak to that?
Yes. As I was mentioning, Abortion Care Network, they every year they do a community needs clinics report, and they found actually only 1% of abortions are provided in physician offices in this country.
Thank you. So I think other questions that a lot of questions came up, but I think some of them have been answered directly in the Q&A box. So we are out of time. I want to express my gratitude once again to all of the speakers and your willingness to be here in an evening, and also to dig deeply into the heart of what we have to figure out if this country is ever going to be all that it has promised that it would be. And that equity be available for all people, regardless of their color, gender, or any of the other factors. Those things aren't currently true. That equality is something that all of us experience equally, which is why we fight for equity. I thank you for being in a conversation that is a different conversation, but is the right conversation. You've received all the information for how you can follow up with us. You'll get an email. Thank you so much, everybody, for participating, and have a great evening.